In the second section, what I'd like to cover is what is the intrapartum care and the neonatal care that we need to give when a COVID positive mother comes to the delivery suite or to the COVID facility for delivery. One of the most important things in this is the infection control practices, which are to be followed both by the healthcare worker, and we in turn need to counsel the mother regarding the same. The mother should wear a triple layered mask. This is for prevention of spread from the source, which is her in this case. She should have appropriate social distancing practices, good hand hygiene. She should be taught how to use alcohol-based hand rub and detergent washes, and the surfaces in her room would need to be cleaned. The healthcare workers should take due precautions of contact and droplet precautions against maternal and any potential neonatal virus aerosols. The screening and testing, as I've already mentioned in the previous section, would need to be done as per the ICMR guidelines. And in case of imminent preterm delivery, the routine practices, that is antenatal steroids, injection magnesium sulfate or antenatal MagSulf, and delayed cord clamping would continue to be practiced. Now, once the mother comes in, we need to assess the severity of COVID-19 in the mother. Mothers who have a severe infection should deliver in a tertiary care facility. Maternal vitals need to be observed, particularly temperature, respiratory rate, and saturations. We need to confirm onset of labor in case antenatal steroids have to be given. Electronic fetal monitoring, that is cardiotocogram, is recommended, and hourly SpO2 monitoring during labor. I would also need to prepare for delivery of the neonate, and the resuscitation guidelines would be the same as the neonatal resuscitation protocol or the NRP guidelines. I need to prepare to take swabs from the placenta, the fetal end of the placenta, amniotic fluid if that is the unit protocol, umbilical cord, this should be done at birth. The nasopharyngeal RT-PCR will need to be taken from the neonate at 24 hours of age and not at birth. Breastfeeding counseling should be given to the mother. This is even before the baby is born. The mother will have to be mentally prepared to say that breastfeeding is the best for her baby, and she will need to come up and do that. This is particularly to be advised if she is mildly symptomatic or asymptomatic. If she is severely symptomatic, this may not hold true. And mother will be isolated till the reports come in, or even isolated from the neonate or separated from the neonate till the reports of the mother and the baby come in. So what is the care we need to take during labor? What is the maternal care and what is the neonatal care? The maternal care, we need to keep the mother's saturations above 94%. The delivery would be as per an obstetric indication. There is no indication to perform a cesarean section just because she is COVID positive. In case there is bacterial sepsis or a suspicion of bacterial sepsis in the mother, we need to treat her. And if it is determined from the mother's symptoms that she needs an LSCS, that would need to be performed. And the neonatal care that needs to be taken is as per the NRP guidelines. For the neonate, we need to have a separate resuscitation corner. This should be at a distance of about 2 meters or more from the mother. The total number of personnel, if it is a low risk delivery, then one person trained in NRP is sufficient. And in case it is a high risk delivery, like for example a preterm delivery, there should be at least 2 people trained in NRP and a team on standby if required. The intubation must be done by the most experienced person in the room, and the use of transparent intubation head boxes, if possible, could be practiced. This is not a very easy practice, but we can attempt it to reduce the virus generating aerosols. Certain practices that we need to follow. Endotracheal administration of medications is something that we need to avoid. Every COVID positive delivery, the team standby should be in PPE kits. Between deliveries, there should be a change of the PPE kit, or if that is not possible, at least a sterile gown placed over the PPE kit, which would be changed following every delivery. This is to avoid blood or amniotic fluid splashes, and the gloves will have to be changed every time. we need to remember that our PPE kits may carry the COVID virus and we should not infect the neonate. We need to change our plastic gowns and gloves if a fresh PPE kit cannot be provided. The labour room management, delayed cord clamping should continue as per the current practice, not earlier than a minute. The risk of viral transmission through cord blood is very minimal. Early skin-to-skin contact between mother and baby if the mother is asymptomatic, and if the baby seems to be doing well, we can do a kangaroo mother care as well. Routine vitamin K administration should be done.